CCRE 2015. My name is Ms. Sherina Balaratnam and I'm the Medical Director of S-Thetics in Beaconsfield. I'm here at CCRE today to present with my colleagues on lip injection strategies and how we can complement your face and your features to give you long-term aesthetic results which are beautiful and as natural looking as possible. Let's run through a little bit of our agenda. We'll talk about our fascination with beauty, lips and aging, and there's a lot of psychology behind this. We'll then need to discuss facial, perioral aging, our patient clinical assessment, perioral and facial anatomy, injection strategies, adverse reactions, and I'll take you through some of my own personal case studies. A little bit about me. Yes, I've trained in medicine. I then went on to pursue a career in surgery. My interest went on to plastic surgery, and I trained in this for 6 years before stumbling upon this beautiful subspecialty called non-surgical cosmetic medicine. I've been training in that since 2008, and I've recently launched a clinic in Buckinghamshire called S-Thetics. So the point of today is to take you also through some of my own personal challenges in recruiting new patients to a new clinic in a new town who want to undergo something that's often very feared upon. So, what is our fascination about aging? What is our fascination about lips? And different people have a different way of aging. My fascination lies with how my friends, my family, myself, and also some of our icons, how are they aging? And some of them are aging beautifully, gracefully, graciously, very well, and perhaps even with doing nothing at all, like Helen Mirren. And some patients perhaps have chosen to take a little bit of help upon themselves, perhaps just a little bit, and have done so rather aesthetically. And others have chosen not to do anything at all. But again, the one thing that all three of these women have in common is they have all chosen to age in a certain way. And as medical practitioners, we have to realize and respect that each patient has their own choice. So how do we reflect on our own current patients? And what are we looking at? They're looking at the media. They're picking up magazines. They're watching The Apprentice. And they're thinking, great, I would like to have my lips done. But what if I end up looking like this in 5, 10, 15, 20 years' time? What am I going to do? I do not want to look weird. And this is where the reassurance comes in. We have good quality products. There are loads available on the stands today. Learn about them. Reassure the patients that we are only using the best. But yes, we do have to understand there are lots of unlicensed, unregulated products around when we choose not to put them in our patients' faces. Where are we facing in 2015? We see lips like this all the time, faces like this. So it's no longer about correction. It's no longer about beautification. We're now looking at change. Where has this all come from? Where are we going? And the one thing that you're going to notice about this is our patients are not like the last 3 slides where they're getting older. They're actually getting younger. So we're getting younger patients showing up as early as their 18s, 20s, so forth. And if you look at Kylie Jenner, she's very young. In my new clinic, I don't get very young patients. My cohort of patients are anywhere between 38 and 89. So I don't get this sort of case, but I wouldn't be surprised if we start to see more and more as we go on. So, lips, back to lips. What do we need them for? We use them to communicate with each other. Happiness, sadness, surprise. But they all sync together with the eyes as well. Disgust, fear, unhappiness. And then there's neutral. But I'm going to use the image of one of the most beautiful women in the world, because when patients come to me wanting lips, they all seem to clutch this photo with them. So what else do we need our lips for? We need to use them not just for communication, but we need them to eat. She does so very seductively. We need them to communicate, to kiss, and also to seduce. So the lips are very, very seductive. But I want to bring back to one of the most iconic pictures that showcases lips. And this is where Mick Jagger took upon a commissioning of the Royal College of Arts. And he asked an artist, and he said, make me a brand logo. And this artist came up with this, lips. And when the artist was interviewed and said, why did you come up with this? And we're talking a very long time ago. He said, well, when Mick Jagger walked into the room, all I could see were his lips and his mouth. And there we go. A legend and an icon is born. So, our key features of youthful lips. And if you look at the picture on the right, this is a picture of one of my friend's kids. Amazing. The kid's not even pouting. Eversion, 2 to 3 millimeters of upper dental show. Projection of the upper lip, 2 millimeter beyond the lower lip. And this is really important. We can't destroy this balance because otherwise we look really proud and pouty. The definition between the vermilion and the cutaneous lip, strong. That's called the vermilion body. The philtrum columns, which are the columns between the nose and the top lip, long, strong, well-defined. There's an increased show of the wet-dry border of the lip, very sensuous. That's a lateral curve from the nostril to the vermilion and upturned mouth corners, which we need to respect. And if we look at proportions of the lip, which have been extensively well researched, we know that they have been calculated using mathematics. And the ratio, or the golden ratio of phi, of 1 to 1.6, has been very well described, not just for the lips, but for the other areas of the face. And that also corresponds to a ratio of 1/3 to 2/3 from the top lip to the lower lip. So I use this triangle of youth, which we have seen in many slides. It's not just for the face, but it also corresponds to the lower facial aging as well as the lips. We start off as a V, looking at the three-dimensional approach to the face, from the skin, subcutaneous tissue, fat, muscle, and we also need to look at skeletal resorption as well. And we notice that the face ages from a V to a H and downward slopes into an A. Look at the lips. The lips are changing. Nothing remains static. So when we restore the lip, it would be unfair of us to just look at the lip and restore that without respecting the rest of the face. So think outside the box. Sometimes rules are meant to be broken. So with lips and perioral aging, and we'll demonstrate this for female lips to start off with and then go to men, but there is loss of all these points, loss of definition. The philtrum columns become longer and they become less defined. There's flattening of the cupid's bow and it tends to look straight. There's deflation of the actual lip, both red and white. There is loss of soft tissue, inversion of the red and the white lip, an elongated white lip, and that's the fleshy bit between the nose and the top lip, and lip lines or bleed lines start to form. Dehydration happens because we lose our natural water resource, which is called hyaluronic acid. That we can now restore using dermal fillers, and we can improve the texture of the skin. Downturned mouth corners tend to happen. Patients say to me, my kids say I look sad all the time, I look unhappy, etc. But looking at the downturned corners, we've got to look at the rest of the face because we get facial changes, bony skeletal changes. And then we also talk about dentition. And my dear colleague, Dr. Sophia, is going to talk about dentition in her next lecture. So with dentition, we then also see a decrease in tonicity of the orbicularis oculi muscle. We've got changes in smile dynamics. So we go from this upturned, full, hydrated, beautiful plumpness, and sadly, it all starts to change. Men, on the other hand, some of them anyway, age a little bit differently from us, lucky you. In terms of soft tissue changes, there still is some. But in terms of the actual smile itself, it doesn't matter too much for men if the top lip disappears, because men naturally have a thinner top lip than us anyway. So if you look at George Clooney, he's doing all right. Some men, however, may have had a strong and rebellious lifestyle, maybe a couple of cigarettes in their time, but nonetheless, with facial aging, it still doesn't look as unattractive or unappealing. One icon of mine, I think he looks amazing. But here are some of the causes of lip aging. And for me, the extrinsic factors tend to play the most when it comes to perioral aging of the lip as well as the soft tissue. Cigarette smoking, not just as a local irritant, but also from the act of pursing the lips, acts as repetitive movements, which causes a breakdown in the collagen and elasticity of the skin. Pursing of the lips happens more commonly in us girls than men. And things like drinking Starbucks, Costa coffees, and sucking through straws. So restrict this as much as we can. Swap the pursing and drink out of a mug. The reason that we talk about facial shapes is because lip shapes tends to have a very corresponding feature with that. And the Chinese look at the psychology behind changing the facial shape. And it's very similar to changing the lip shape. If you change your facial shape, they say, it changes your destiny in the path that you're meant to have in life. So that's the one thing we need to think about when we restore our patients' faces and their lips. And many of us have different facial shapes. Not all of us. Some of them we can identify with. I would love to identify with some of these girls, but I guess this is what gives us our beauty and individuality. So lip shapes. Allergan have done a really good study back in 2013 looking across 3,000 lip shapes, and they've come up with 5 of the most common. So you've got your heart, your ellipsis, the ribbon, the bow, and the apple. The top 4 are more Caucasian. The last one is more Oriental in nature. And to go through them, the heart would be your classic Angelina Jolie, your ellipsis would be Scarlett Johansson, the ribbon, more Jessica Alba, and the bow, someone like Julia Roberts, and the apple, as I said, someone more Oriental. So the key nowadays is, what are patients looking for? Barb's released this in their cosmetic surgery statements, looking at tweaked, not tucked. But I use this also for non-surgical. My patients want less, not more. They rather have refreshed versus looking done. They don't want unsubtle. Doctor, Sherina, please make me loose, less angry, less tired, more hydrated. I want to look the best that I can for my age. I don't want to look 20 anymore. But we need to manage expectations, so not to go for drastic changes. So what do I do in my clinic? Full clinical assessment. In my new clinic, we carry out a 1-hour-long consultation. Very detailed. We start off with the Visier digital skin analysis. Now, you're probably wondering, why do a skin analysis in someone who's actually made a booking for lip augmentation? It would be unfair for me to not address the status of the skin, the soft tissue, and the patient's skin health. So we do this, and this gives us an understanding of what the tissue integrity is around the lip. We then do a full facial assessment, and we need to respect that the lips move. So we do static and dynamic. We ask all our patients to bring all photos of themselves, and it's difficult when you have a 70-year-old bringing a photo of their 20-year-old self. So again, make them realize, you bring a series of them. And this manages the expectation well. Once we've done a detailed consultation, we go through the product of choice, how we're going to do it. And I do believe in a strong cooling off period, especially when it comes to someone who's never had facial treatments like this before. Don't forget to ignore your side profile of the patients. Look at them from the back, the front, the sides, and respect the Steiner line, which is the projection from the tip of the nose columella to the pogonium of the chin. And Steiner describes if there's any deflection of the lip in front or below this, then that's away from the norm. The facial anatomy should be respected. The lips are surrounded by the orbicularis oris muscle, and you've got lip elevators and you've got lip depressors. The key thing about lip elevators is that they do get lax as we age, and the lips will then curl downwards. The lip depressors, however, get more hyperactive as we age, and when they get more hyperactive, we can then combine the use of not just filler, but we can use toxin on the lower face to help release those extra tonicity and correct the downturned corners of the face. With lip innervation, we have sensory branches of the trigeminal nerve, and with motor function, they tend to come from mainly the buccal branch and the marginal mandibular branch of the facial nerve. The facial artery needs to be respected, especially with innervating the lips, with supplying the lips. And a branch of the facial artery comes anterior to the masseteric muscle, and it comes up to supply the top lip and the bottom lip, while the superior and inferior lingual arteries. Where they lie is between the actual cutaneous border and the orbicularis oculi muscle, and it lies behind that. So if you were to put your finger into your mouth, you should be able to feel your pulse just superficial to the skin. So I would never inject deep to the mucosa. And you can see this in this slide with the labial artery just deep to the muscle. So lip and perioral rejuvenation, I always start following my Visier skin analysis with lip and skin care. I use a combination of topical antioxidants. All my patients have to be on an SPF, and they're all on retinols. We then think about skin resurfacing to address the lipstick bleed lines, and we have a beautiful skin resurfacing device, as well as use a combination of topicals and chemical peels. With injectables, more often than not, it's not just dermal fillers, but I combine them with some botulinum toxin in the lower face, as well as platysma muscle, and that gives a much more rejuvenating approach to the lower face. But knowledge of anatomy, our product pharmacology, as well as the technical delivery is very key. Needles versus cannulas is always well discussed. So the way that I do it in my clinics is I use a rather strategic approach. And the reason that I use this is because it gives us the ability to respect the lip in certain subunits. And our dear colleague, Dr. Maurizio Di Maio, has released these MD codes this year, which gives us doctors a language in which to communicate also. He defines the lip into 8 key areas which we should look upon injecting. The first 5 are all intramucosal, and the next few are within the tissue itself or within the skin itself. So the first point corresponds to the vermilion body, and that's to give the body a little bit more strength and definition. The second point is to address the Cupid's bow. So again, we're going back to the youthful lip. This is what we're trying to correct. The third point is referring to the lip borders itself. The fourth, the medial tubercles, giving the sensualness. I would be careful to do this extensively in a man. The fifth are the lateral tubercles, which the fourth sips upon. And the sixth, the commissures. 7 and 8 are very key because 7 restores the actual strong pillars of the lips and gives us its beautiful eversion. Very important to do in patients, especially with elongation of the white lip. And finally, perioral lines. In the old days, we used to think, let's just attack the perioral lines from the front, but we've got to be so careful with the choice of product in this area. I don't do this technique. I go from the sides and go from underneath, and that way you don't see any reflection of light of the filler, and there's much less risk of unevenness or bumpiness. We now have to think about the chin, restoring the normal facial thirds. I tend to do a lot of this in my practice now, because as Mr. Rajiv Grover's told us, with the chin being the pedestal to the lips, you can't just treat the lips and not look at the chin. So this is a really nice area to treat, where we call C1. It's submenton. Dissecting it with a cannular approach doesn't just make it look aesthetic, but it also elongates the face. My products of choice are all hyaluronic acid. I've not injected with any other types of product before. So I use an FDA-approved hyaluronic acid of low to mid viscosity. I've been using Juvederm Vicross for a long time, and I've been getting very nice results from it, with results lasting up to about a year. I tend to now use more Juvederm Volift to inject the lip and the lip body itself. And I use Juvederm Volbella for a slightly more hydration effect of the lip, for somebody not necessarily wanting augmentation. And I always use Juvederm Volbella on the perioral lines around the mouth, as it's much softer and it gets a much more integrative quality. How much do I use? I often get asked. I get patients saying, do this. And my answer is no. I believe in a much more staged approach, using 1 cc of filler at the first session, bringing them back, because we need to respect that these fillers are very water-loving. And then we can always retreat at the second sitting. How much per each of those injection sites? 0.05 cc per injection points. The next thing to think about is, what would I use for that mental crease? And it would be a choice, either between Juvederm Volift or Juvederm Voluma. And for more information about that, please do discuss this with the stands out front. I think it would be wrong to mention dermal fillers without talking about adverse reactions. But talking about adverse reactions, complications, and the management of these can go on all day. So if anybody wants more information about these, please do come and corner all of us after the presentations. We'll be more than happy to go through our own ways of managing this. But fortunately, adverse reactions are uncommon, but they do exist. They're mild and transient. So think about where you're putting your product, what you're using, who you're putting it in, how much you're putting, and how long you want it to be there. Infection can occur with improper technique and poor sterile conditions. So always prep your patients. If patients say, I don't want to take my makeup off, doctor, do not inject them. Okay. Finally, we've got immune reactions. Granulomas are very rare. When we see patients presenting with a multiple of injections within them, they may have other products within their skin. We need to be able to get and extract this information out of them from a good medical history. And finally, this is very important, vascular, either arterial or venous. Know your anatomy. Make sure you're not injecting. If you inject and you see pain, pallor, anything out of the norm, extra pain, stop your injection, pause, put some warm compressed gauze on the area, and leave it, and leave your injections for the day. And these are my final rules. So respect your anatomy. Think of the lines that we've been granted through research, through mathematics. The lower lip should always be fuller. Never inject and over-inject the top lip. That's the trout pout. That's what we don't want. Tailor, customize your treatments to each and every face. Never overdo and overcorrect. Bring your patients back. We're new in this. They want to gain your trust and your respect. Manage your expectations. And I always review all my new patients. I'm now going to hand over to Raj, who's going to do a beautiful presentation for you. Thank you very much.